Hello and welcome to a brand new episode of COVID 360. I'm Sneha Mordani. Now, exactly 6 months ago, India's reputation took a beating as the Western media criticized us during the second wave of the pandemic that overwhelmed India. The situation was such that even the most developed countries were crumbling with cases of COVID surging. Hospitals getting overwhelmed courtesy the deadly Delta variant, not just in India, but outside of India as well in the most developed nations. But India was picked on. Not to say that India was perfect at what it did. There were mistakes and there were lessons. But the finger pointing at us, ignoring the problems in developed countries like the US, for example, was stark and in your face. In this episode of COVID 360, we get you comprehensive reports on what the most developed country, the richest country in the world, America, did. The attempt is to not pick on this country, but to underscore what India did right in comparison to the US and how America did not get everything right. First up, this report that we're getting you on the current ground situation in the state of, in the United States of America, that is now being ravaged not just by the highly infectious Omicron variant, but also by its own mistakes, from inadequate testing to testing scams, to record number of children getting hospitalized. Health infrastructure in the country is in a mess.
America's mismanagement of the COVID pandemic has been starkly exposed. As Omicron ravages the United States, hospitals are under immense strain. Emergency rooms, urgent care centers and doctors' offices are overflowing with cases, and very few staff to tend to them.
We have 1,800 Americans dying a day. We have nearly 1 million people testing positive a day. So this is not counting for all the people who may not get tested because of capacity issues or who are getting rapid tests at home. Time that we are now going through is the hardest. We have never seen this degree of staffing shortages. About 30% of staff is not present in the hospitals. Either they're sick or they've retired or they've gone somewhere else to work with.
Hospitalizations of children because of COVID is at the highest level since the start of the pandemic. More than 90,000 children under 17 years have been hospitalized between August and mid-January. On an average, close to 900 children are being rushed to hospitals every day. The highest number of hospitalizations are among children up to 4 years who are not yet eligible for vaccination.
That the Delta variant, the number of cases doubled in 2 weeks. With Omicron, the number of cases doubled in 2 days. So it's highly transmissible, infects a lot more people. Children were the most unvaccinated group in our country, right? Children vaccine became approved later on. About 30% of children were vaccinated. So a very large pool of children unvaccinated. On top of that, you open the schools.
Dismal testing rates have left Americans in a lurch. This despite President Joe Biden's promise in December of 500 million free coronavirus tests to Americans.
The federal government will purchase 1/2 billion, that's not million, billion with a B, additional at-home rapid tests with delivery starting in January. We'll be getting these tests to Americans for free.
But it's still not definite when the promised 500 million at-home COVID-19 tests will be shipped out to American households.
A number of people that is in the millions of Americans who have not been vaccinated and could be vaccinated, and we are urging them to get vaccinated because it will save their life.
Amid this crisis, America has also been hit by a testing scam. The Center for COVID Control shut testing for a week after it wasted 40,000 tests, where people get no results or late results or false negative tests.
America's health experts believe that the government did not go into the pandemic from a position of strength. The miscommunication that Omicron is mild also led to large spread disinformation in the communities. But the government was also not prepared to handle the kind of load. And experts say that this is perhaps the worst and the most vulnerable time for America, even after being one of the first nations to have a vaccine. More than 70 million Americans are still not vaccinated. With Ashok Banot, Milan Sharma for India Today.
The healthcare infrastructure in America is falling apart. But apart from the surge in cases and difficulties the system is facing in the most developed country of the world, another problem stands out. Well, that of the confusing messaging from the US CDC on masks and also an organized campaign against vaccines, which the US has not been able to quell. An organized anti-vaccine movement in the most developed country of the world.
The antidote that we've seen now, and we have tons and tons of research, is urine therapy. Okay? And I know to a lot of you this sounds crazy, but guys, God's given us everything we need.
Anti-vaxxer Christopher Keyes, who was arrested for not wearing a mask in court, here saying that instead of vaccine, one must drink urine. This is worrying, say experts, particularly because the anti-vaccination movement in the United States of America has been organized and ingrained.
Vaccine hesitancy among adults continues to be a public health problem, especially in developed nations like the United States. In the US, approximately 15% of adults have not taken a vaccine. In comparison, in Kerala, southern state of India, where the population is 35 million, 99.6% of adults have received at least one dose of vaccine, which means vaccine hesitancy is less than 1%.
There is no dearth of data to show the benefits of a vaccine, but wrong messaging from the leadership can lead to several failures from treatment to medication.
And a little feeling of pressure.
If you remember, Mr. Trump, the then president, was in denial of the virus, even mocked the virus, and then went ahead and promoted hydroxychloroquine as a drug which is going to save us from this virus, which we all know never ever happened. Then there were significant delays in putting in place the mitigations which we needed at the time to prevent the spread of the virus in the United States.
Flip-flops of the Center for Disease Control and Masking guidelines was yet another blunder. The CDC went to the extent of saying that those who are fully vaccinated can do away with masks in indoor settings. Even President Joe Biden was seen without a mask. Within a span of few days, the US was forced to go back to masks as Delta surfaced.
Vaccines were done, vaccines were rolled out, and then CDC comes up with this new decision to take off the masks if you're vaccinated, which again was not the right decision, because if the virus was still around, it was just a matter of time that the virus would spread further and the new variants would come, as we have seen it. And that's what happened. Even at the time, CDC was repeatedly asked to review this decision. But nevertheless, that was... I would say that was one of the wrong decisions of the time.
Misinformation, lack of information is one thing, but when you have about 12 people, just 12 people responsible for 65% of disinformation, literally wrong information, there are multiple different levels of why we are in this situation. And then, of course, it's an ever-changing virus. We need to approach it from a position of humility.
The US CDC also recommended the shortening of the isolation period, drawing heavy flack.
We will not comply. The messaging from the government itself has not been uniform. Like, for example, in India, we have had senior-most officials of the government constantly saying that, wear a mask, maintain social distancing. Whereas in the US, we, as far as March 2020, Fauci himself was saying that there is no need for masks, it doesn't help. The President of the United States at that time had made remarks like it's the flu.
Public policy is key in handling a pandemic, and in a developed country like America, there was messy policy and messy messaging essentially, more often than not. Many medical experts are of the opinion that a developing country like India was far more consistent and did much more better than a country like America, which was fairly inconsistent in its public messaging when it came to masks, isolation and other things in these last 2 years. In New Delhi, Sneha Mordani for India Today. All right, let's take a look at the ever-changing COVID guidelines of the Center for Disease Control in the United States of America. What were the guidelines then? On the 27th of December 2021, they said decreased isolation time for the general public. They received a lot of flack for that. Now on 27th of December again, 5 days isolation for asymptomatic patients is what they said. On 23rd of December 2021, they spoke about decreased isolation time for healthcare workers that actually many say and data suggests led to a big increase in the number of cases in the US. On the 23rd of December again, asymptomatic healthcare workers can return after 7 days is what they said. On the 9th of December in 2021, they said 16 to 17 years of age group can get booster shots. On 29th November, boosters after 6 months of Pfizer, 2 months of Johnson & Johnson. On 19th of November, they said boosters after 6 months of Pfizer and Moderna dose. And of course, we know about the masking guidelines and how that also changed throughout last year when it came to masking indoors and masking outdoors. All right, now let's take a look at what the CDC is saying about N95 mask and the very latest on cloth masks. This is the latest guideline.
The U.S. Centers for Disease Control and Prevention have revised their guidance for Americans on wearing masks to protect against COVID-19, recommending wearing, quote, the most protective mask you can and that you will wear consistently. But the agency stopped short of advocating nationwide usage of N95 respirators, which filter at least 95% of airborne particles, both large and small. A surgical mask, by comparison, is designed to protect others against virus particles that are breathed out. The agency on Friday said it wants to encourage Americans to wear masks rather than push them to wear the highest grade face protection, but also explicitly said that respirators provide the best level of protection, while, quote, loosely woven cloth products provide the least protection. N95 masks are flying off the conveyor belt at Protective Health Gear in Paterson, New Jersey, as the manufacturer ramps up production amidst the Omicron surge of the coronavirus in the U.S. The company's CEO, Brian Wolin, says demand is through the roof.
I've been saying since day one, if they could make these available to everyone on the planet, I personally believe that every problem that we had wouldn't be here at this particular time. Now, certainly, these weren't available in abundance back in 2020, but they are now.
The factory is operating 24/7 to manufacture 70,000 N95 respirators per day and plans to increase that number to 110,000 in the coming weeks as demand heats up. Critics have accused the CDC of offering shifting and confusing guidance throughout the pandemic regarding mask wearing. After announcing Thursday that the federal government plans to make high-quality masks available to Americans for free, the White House on Friday said the government will also begin shipping 500 million COVID-19 tests to Americans later this month without charge. COVID-19 infections in the U.S. are at their peak, with nearly 780,000 new infections reported each day.
Now, COVID-19 cases surpassed 66 million, with death toll surpassing 8,51,000. Data suggests that since the U.S. Center for Disease Control and Prevention shortened the isolation period for healthcare workers diagnosed with COVID-19 in epidemic prevention guidelines, last month the number of cases of newly infected in hospitals actually surged in a very short period of time. Take a look.
The cumulative total of confirmed COVID-19 cases in the United States exceeded 66 million as of Monday, with the death toll surpassing 851,000, according to the Center for System Sciences and Engineering at Johns Hopkins University. The U.S. Business Insider cited data from the U.S. Department of Health and Human Services that since the U.S. Center for Disease Control and Prevention shortened the quarantine period for health workers diagnosed with COVID-19 in epidemic prevention guidelines last month, the number of newly infected in hospitals surged in a short period of time. In the week after the CDC issued the guidelines, the number of people diagnosed with COVID-19 after 2 weeks of hospitalization jumped by 80%. A latest poll shows that nearly 2/3 of Americans believe that the US government has performed poorly in its response to the epidemic. In terms of the US government's performance in fighting the epidemic, 64% of the people surveyed believe that it has performed badly. Bureau Report, India Today.
United States of America has reported a big surge amid the holiday season. Let's take a look. Let's consider first the 15th of December and the manner in which cases increased. Essentially from the 15th of December, where 1,42,000 cases were being reported. We saw a gradual increase during the Christmas celebrations, and of course cases increased post 20th of December, 4th of January, and it reached around the 14th of January. In fact, the cases started to dip in the United States of America. But this was the kind of massive increase that we had seen this period between the 15th of December to the 14th of January. All right, now let's take a look at the deaths in the United States of America, reporting the maximum number of deaths in the entire world, essentially in the manner in which it surged also again in the same period from the 15th of December. A bit of a decline here, a very small dip somewhere around the end of December, but then again an increase to almost 3,000 around the 14th of January. The deaths, of course, ever since thankfully have declined in the United States of America. We're pausing here for a quick break. Much more news around the pandemic on the other side. The United States continues to battle a massive surge in Omicron cases across the country. With mounting concerns due to the surge, parents of California's Burbank have withdrawn their kids from schools and are demanding increased testing in schools and offline classes for all students. More details on this next report.
With the Omicron variant causing a steep surge in coronavirus cases in California, some parents are deciding to withdraw their children from schools. Yelena Wheeler from Burbank in Los Angeles County is one of those parents. She feels it is foolish to have children congregate at a school during the Omicron surge. Wheeler and her partner, both health workers, are parents to 5-year-old CJ, who is in kindergarten, and 8-year-old Cambria, who is in 3rd grade. Their children have not attended school for the past 2 weeks. They have also not received any alternative education like online learning.
It's just sending kids to a chickenpox party at this point. And even though, even from the CDC saying everyone's going to get it, do we all have to get it right now at this point in time, and to tax our healthcare system even more? So that's basically our stance.
And then the pilgrims took over.
To date, the parents say they have followed all the guidance given to them by the schools and the school district. Wheeler was one of a group of parents who held a 7-hour meeting with the school district demanding that there be mandatory testing.
I mean, we understand nothing is guaranteed safe, but it's one thing if all other districts were not doing mandatory testing, but one of our biggest districts right next door to us, 3 blocks away from here, LAUSD, has mandatory testing, and we don't.
One of the arguments to keep schools open during the pandemic is that doing so in turn helps businesses stay open because parents can return to work.
So the fact that they're saying, well, it's gonna, if the school shut down, it's gonna affect all the businesses. Guess what? All the sickness that could be spread in schools are gonna affect the businesses anyway.
Although she is yet to receive a letter from the school district about her children's truancy from class, other parents have received notices, plus the threat of fines, or even worse, if their children don't return to school. Bureau Report, India Today.
Hundreds of students in Chicago walked out of classes in protest demanding a switch to remote learning as a surge in COVID-19 cases fueled by the Omicron variant disrupted efforts of returning to in-person education around the United States.
Students in Chicago walked out of classes to pressure officials to switch to remote learning as a surge in COVID-19 cases fueled by Omicron variant disrupt schools around the United States. The latest wave of infections has renewed the debate over whether to keep schools open, as officials seek to balance fears about the highly contagious Omicron variant with concerns that kids would fall even further behind after 2 years of stop and start instruction. Students had just returned to Chicago schools after a week of cancelled classes due to standoff between teachers and the school district over COVID protocols. The teachers' union agreed to return to in-person instruction after striking a deal to strengthen safeguards. Nearly 5,000 public schools across the country have closed for at least one day this week due to pandemic, according to Burbio, a website that tracks school disruptions. Overall, the United States is still tallying nearly 8 lakh new infections a day and record levels of hospitalized patients with COVID-19. Bureau Report, India Today.
A look at how COVID-19 is tightening its grip when it comes to children who are bearing the brunt in the United States of America. Over 580,000 cases have been reported in children, essentially. This has been detected till the 6th of January. Only 325,000 cases are found in children by December 30th. Essentially, we've seen a big increase in infections in children over the last few days, or at least 78% increase in detections from December to January. The Pfizer-BioNTech vaccine for kids between the age of 2 to 4 is in the works. 2 doses of the 3 mg Pfizer doses shows inefficient protection in children. The vaccine study on kids under the age of 5 is to conclude by April. Well, that is all we could pack in this edition of COVID 360. Until next time, stay safe and do get a shot against COVID-19. Do get the precautionary dose if you are eligible. Continue to watch this space for all the necessary information on the 5th variant of concern. Thanks for watching.